Hello, I'm Dr. Deepak Devakar. Is hair transplant safe for your age? So it depends at what age you are deciding to undergo hair transplantation. We can divide it into four brackets. Between 20 to 30 is the first one, 30 to 40 the second step, 40 to 60 and then beyond 60. We have patients who have undergone hair transplant beyond 60 also. Now, between 20 to 30 is a very sensitive time to undergo hair transplantation because their progression of baldness can happen and we'll have to balance the existing hair and where you are going to place the transplanted hairs. So don't hurry at our early 20s to go for hair transplantation. Do a consultation, understand your requirement, try the medical options first, try to postpone the chances of hair transplantation at an early age as much as possible. Now, the donor availability is the area which is the back of your scalp where we extract your hair follicles and transplant to the required area. This donor is a fixed number of hairs. So if you are utilizing at a very younger age, then there is a possibility you may not have enough donors to transplant in the future if there is any new patches of baldness which are developing. So we suggest to do it at the right age and do it when it is more important or you are not able to cover your scalp. Now, if these corners can be just covered by combing your hair, then probably it is not required to go for a hair transplantation. You have to improve your existing hair, which will increase the thickness of your hair and cover the scalp well. At early ages, it may not be suitable to undergo hair transplant. But around 30s, we see many of men who have already reached a significant baldness and they may have to go for hair transplantation. It may be for their personal reasons or appearance or any such their social priorities which they have. Now, doing transplant at that age, their health is in a good condition. They can go for a transplantation, they may not have any medical issues and they are fit to undergo for hair transplant. But as their age progresses, when we come to 30 to 40 years of bracket, many have different health issues. There may be obesity, there may be hypertension, blood pressure, cardiac issues, lifestyle problems. All these have to be looked into before undergoing transplantation. At this age, between 30 to 40, you will have to understand your fitness to undergo for surgery. Everybody will tell surgery is safe, but are you healthy to undergo hair transplantation? You should have a good health condition to go for hair transplant. Surgery of hair transplantation is not a complex procedure, it is very simple, but it is taking prolonged period of time, 5 to 6 hours or sometimes 7 hours for an entire surgery. So this long procedure, you should be medically and healthy and fit. So we do a detailed blood examination, the health physician fitness before surgery so that you don't have any health issues and you don't end up with any complications at the age. Now, obesity is also a bigger problem when undergoing hair transplantation. After 30 or 40 years or sometimes even at younger ages, if they are putting on too much weight, the position where we are going to start the first step of surgery, where it is an extraction, where the person has to lie down with face down and we are taking out roots in the back of the scalp. So continuously their tummy, heavier tummy if they are obese, it will be pressing on their chest because of which the breathing may be difficult and it may be prolonging for long hours of surgery. So you will have to be very conscious about this situation, and if you are facing any breathing issues or difficulties in breathing, inform your doctor immediately so that we can adjust the position. In our clinic, we have got different instruments where we can make the person comfortable during surgery. The positioning of the bed, the positioning of the patient, the positioning of pillows to support them well so that they don't have a problem with breathlessness in such obese patients too. By taking care, you will be comfortable during surgery also. Any such medical illnesses or issues should be treated in advance and a physician fitness should be taken to undergo such surgeries. Now, when it comes to 40 to 60 years or beyond 60 years, if a person is fit and their donor is good, if they have a good quality of donor, then you can go for a transplant. But there may be progressed stage of baldness. Sometimes they have significant amount of hair loss which is already developed. But if they have a good donor, still we can give a significant improvement in their appearance. The front transplantation significantly changes their appearance and it creates a frame for the face. If a person is bald, their face is looking more round and more aged. But by having some amount of hair, just a smaller area also at a later ages, then gives a significant change in their appearance and it changes the frame of their face, which makes them more younger looking. And it is possible, we have done at beyond 60 years also, we have done hair transplantation under the correct medical care. There is no risk or complications which is going to happen. In women and men, both we have done hair transplant surgeries. I myself performed more than 2,500 surgeries over a period of 15-16 years now, and we never had any problem with any patient, aged or younger patients also. So at 60 years or beyond, or probably early also, they may be having medical conditions, cardiac issues, diabetes or hypertension. None of these medications have to be stopped before surgery. It is better to continue them, keep taking it regularly so you are in a healthy condition, have a proper healthy diet, sleep well, and on the day of surgery, it is going to be easy procedure. There is no need to get stressed, and you'll be comfortable if you are doing the surgery in the right place. It is also important that you select a qualified, experienced doctor who is doing surgery completely by themselves. At our clinic, I have been doing surgery for more than 15 years now, where every patient from beginning to end of surgery, I myself perform, so that we can give a safety and assurance of results, and quality of the procedure also will be good. This way, a patient care is our first priority. Our first importance is given to such conditions.